Dr. Pasricha, what foods feed the good bacteria in our gut? How do we make the bacteria in our guts better? Dr. Laster, what are pelvic floor disorders and how common are they? And what do women do to avoid pelvic floor disorders? Dr. Montgomery, are we trying to avoid salt? Is this implicated in heart disease? And Dr. Kahn, you wrote an article called Why Your Cholesterol Does Matter, Ignore Nonsense Claims. Please explain that.
Okay, great. So your question was what foods or what feeds the bacteria in our GI tract? So, well, what feeds us is going to feed our gut bacteria. You know, we've all heard that expression, you are what you eat, but it's not just you are what you eat, you are now what your gut microbiome is eating. And at this point, we have numerous articles, numerous research studies that show us that if you eat a variety of fruits and vegetables, that's really the best thing you can do to feed your gut microbiome. The initial research came from Rob Knight, and they did the American Gut Project. What they did was they looked at American like citizen scientists. So they studied the gut microbiome in people like you, me, just nationally across the country, living their daily lives. And they did analysis to see what's the gut microbiome looking like in those patients. And then they did analysis to see which patients and why is it that certain people have a healthier gut microbiome than others. And really what they found was that those people who eat a variety of fruits and vegetables, those are the ones that are going to have the healthiest gut microbiome. And in this research study, they actually kind of quantified it. They found this number 30, that if you can eat more than 30 different fruits and vegetables in a week, you will have the most robust, healthiest gut microbiome. Now, I don't think there's anything special about the number 30. I think that's just to kind of give us an idea. If you're somebody who eats 28 or 33, like, I don't think you need to be stressed about that. And I think the basic concept is that the more different types of fruits and vegetables that you eat, the lower the processed food, the lower the alcohol, the refined sugars, that's what's going to get your gut microbiome to be the healthiest. So, you know, what you eat is really feeding your gut microbiome. We used to think that the gut microbiome was static, that it was in our GI tract and did not do much. We now know that is not true. Our gut microbiome is active. It is involved in hormones, in our immune system. So it does play a really vital role. And the best thing we can do is to minimize animal products and to focus as much as we can on different fruits and vegetables.
Thank you.
And all right, the question I think that was directed to me was pelvic floor disorders. And pelvic floor disorders can affect your urinary tract, so your bladder, your urethra, your rectum, your intestines, and what the pelvic floor is a group of muscles that sort of are able to sort of hold that, sort of to protect that floor of organs. So patients will routinely sort of present with urinary symptoms like urinary incontinence or urinary leakage. They can present with prolapse, whether that be rectal prolapse or uterine prolapse. Patients can also, what we see mostly is fecal incontinence, and sometimes we can see prolapse, rectal prolapse as well. And so we have a lot of fancy tests in GI as well to sort of test these things. And one of them I warned my patients about a little bit is probably not the most exciting thing that you ever want to go through, but an anal manometry where we're able to sort of test those muscles in that area with anal explosion of a balloon. And so what the most common thing is, and my patients will sort of get sick of me talking about it, to help with sort of fecal incontinence and to help with sort of colonic transit, sort of to help with those symptoms, are sort of dietary changes with fiber. Yes, and sometimes sending patients to sort of therapy to be able to have pelvic floor exercises to help sort of strengthen those muscles as well. Sometimes women will see it as we get older, women after sort of childbirth of very large babies, or sometimes that they've had to use particular types of forceps during any type of obstetrics procedure. Sometimes patients who may have had surgery or some type of nerve damage to that area as well. So there are many reasons why people will have pelvic floor disorders, and sometimes there are surgical approaches if patients are a candidate to be able to repair those areas. And a lot from the GI perspective for the fecal incontinence, if somebody has pelvic floor disorders or fecal incontinence, are sort of, first we try to do things sort of without surgery, without people having to undergo any procedures. So trying to change sort of their intake, getting patients to have more water, getting more fiber, trying to sort of be able to bulk that stool so you're not having that loose sort of incontinence. So you'll be able to have that sensation with more sort of stimulation throughout the colonic tract so that you feel it and you're able to sort of be able to hold that, so stool isn't so loose, so you're able to control it and to sort of pass stools without having accidents or episodes of incontinence. So that's the sort of the skinny pelvic floor disorders and sort of how they relate to GI disease.
I'll jump in if that's okay for just one moment. I actually did motility training, so I specialize, my area is pelvic floor disorders, and I do a lot of anorectal manometry. So just one or two things to add is that, you know, a lot of our patients will come to us complaining of constipation. And yes, the first thing is we do counsel them on diet. But even after eating a high fiber diet, they'll say, you know, I'm eating 50 grams, 100 grams fiber, I'm still bloated, I'm not going. So if you have that feeling of incomplete evacuation, if you are not emptying all the way, if you're pushing or you're straining, it really could be a pelvic floor issue and a rectal muscle issues. Those muscles need to relax when they're supposed to relax, tighten when they're supposed to tighten, and work when they're supposed to work. And for many people, it becomes discoordinated. We don't always know why that happens. You know, part of it is one that a lot of people, when they have to use a bathroom and poop, they're going to hold it in. They might not want to use it in a public restroom. We're seeing this a lot in younger people too, because they might not want to have a bowel movement at school. So they hold it, and they're starting to train their bodies to not go and to not listen to their bodies when they need to have a bowel movement, and that can affect those muscles. About 50% of patients who have slow colon and just like their colon moves slowly and causing constipation, half of those will also have a pelvic floor issue. So you really can have both. And one way we manage it is with the fiber and getting things to move, but the other way is, yes, pelvic floor physical therapy. The other reason that we are seeing a lot of pelvic floor issues is because we don't poop the right way. That's like as bluntly as I can say it. You know, kids, if you look at them, they'll often squat. In many other countries, when they have a bowel movement, they are squatting. And that's really the right way anatomically for us to have a bowel movement. But, you know, we all use Western toilets. And when we do that, it changes just the anatomy just a little bit and makes it more challenging to have a bowel movement. So many of these patients also benefit from using a small step stool, maybe the size, you might have it at home. If you put your feet on it, it changes the anatomy a little bit. You know, there's a company, Squatty Potty, I'm not affiliated, but they've done a great job marketing. And that's exactly what this is for. I do recommend patients who have constipation. It's a great thing to try, and it helps many of them. Is just raise your legs a little bit. It changes the position and it can help with your constipation. So, you know, there have been a lot of research studies showing that people who have constipation, people who have fecal incontinence, they do not seek help because they don't think there is a way to fix it. And there's a stigma against it. So the only last point I'll make is that if you have those symptoms, please talk to your doctor, talk to your gastroenterologist, because there are definitely ways that we can help you and we can fix this. And we don't always do a good job asking about these things. So don't feel embarrassed to talk to us, because we really can get you to feel better, because these things significantly affect people's quality of life. You know, they have to wear pads or diapers, they can't leave the house, they get bloated because of the constipation. So there is help. So please talk to your doctors and see.
Thank you.
My question was, does cholesterol matter? Why did I write an article? Only to say that 98% of the cardiology world would ask, why is that a question? But there's a noisy 2% that question the role and actually encourage people to have a high cholesterol for the brain and their hormones and the like. There's a new book out in the last few months called The Clot Thickens that's rehashed of other books that have questioned it. When you talk, academic medicine and science, one of the better groups is called the European Atherosclerosis Society or the European Cholesterol Society. And the premier paper they have out a couple of years ago is that LDL cholesterol is causative. It's the cause of clogged arteries. The only confusing part about it is that there are people with high cholesterol that don't get clogged arteries, and there's people with low cholesterol that do. It's a risk factor. It's not the only risk factor. Certainly, if you stack risk factors, high LDL cholesterol plus smoking, plus glucose intolerance, plus inactive life, plus high blood pressure, you're certainly going to multiply it. But it would be unwise to walk through life with a cholesterol of 280 or 330 and not at least get that simple heart CT scan or some other parameters to see how it's all working out for you. You might be the exception, but you might be the next statistic. So LDL cholesterol causes atherosclerosis. The kind of lifestyle approach to rectifying issues can be dramatic in lowering LDL cholesterol without medication, or if we need, we have this enormous choice of cholesterol lowering medications now we didn't have even 5 years ago.
Thank you.
Yeah, my question regarding salt, the main comment I make about salt is that our diet is so laden with added processed salt that, lots of people, have, it's sort of like the sugar issue in the sense that, if you were in this perfect world and you had only naturally occurring foods and minerals and nutrients in their natural environment, then we wouldn't have the problem. And so, but we don't live in that world. So things like sugar are not in their natural form, and we don't consume them in the natural ways with non-hybridized or GMO fruits, et cetera. We consume them in processed forms or manufactured forms. And similarly with salt, the vast majority of salt that people consume has been heated up to 2,000 degrees, it's added talc to it, et cetera. So many of the salts we consume are natural. So we're bathed in this unnatural salt. So from birth on up to adulthood, we have this whole biochemical milieu that's been contaminated by salt. So the vast majority of salt is overly processed salt. Now, you look at our blood, it's, sodium chloride is kind of the main nutrient. So to say that we need absolutely no salt would be too much of an extreme. And they've done studies where some of the recommendations of these very, very low salt diet recommendations have gone too far. The point I raise is to have, make to patients rather, is to have them eat foods, natural food in a natural state. Plant foods, herbs. There's some foods, celery has sodium in it, sea vegetables has sodium chloride. So there's some plant foods that have naturally occurring sodium and salt-like materials. So if you consume foods that's minimally processed as close to its natural state as possible, I think that you're going to be in the best shape possible. But I want to emphasize the natural aspect of things. The other part is that when people look at, foods and it's processed foods and it says, okay, low sodium, but there are many other preservatives in these foods. And so salt is not the only culprit. There are many dyes and chemical preservatives that are also bad for your arteries and your microbiome. So, even though, yes, salt is a problem, you don't want to add salt to your diet. You want to eat whole natural foods, use lots of herbs and seasoning in the natural state. But you don't want to just be so, focused on salt where you ignore other toxic substances, preservatives and the like that can also be harmful. And just a quick word on cholesterol. I agree that a high cholesterol is strongly associated with atherosclerotic coronary disease, but high cholesterol is associated with other diseases too. In Colin Campbell's study, in the China study, high cholesterol is associated with cancer. So I look at high cholesterol not only as a causative agent of atherosclerosis, but I look at it as a metabolic disorder. It's a process in which the liver is not functioning normally. If your liver is not metabolizing cholesterol normally, whether it's too much or too little or whatever, then that's an underlying metabolic process that needs to be corrected. And yes, you can be predisposed to atherosclerosis with a high LDL, but as Dr. Kahn pointed out, you can have a normal LDL and have atherosclerosis too. So, disease states is multifactorial. And although we can find some strong associations in some blood tests and not strong associations in others, we need to look at the body as a whole and address it as a whole. And we don't want to just sort of look at one micronutrient or the other. But those are my comments on salt and cholesterol.